Paris, starting in January, Illinois students ages 7 through 17 can take up to 5 mental or behavioral health days off from school without having to provide a doctor's note. Under the new law, recently signed by Governor J.B. Pritzker, students are referred to school staff for professional help after their second mental health day. Joining us to discuss this new legislation and what it could mean for the mental health of children are Dr. Tara Gill, psychologist and mental health consultant with Lurie Children's Center for Childhood Resilience and assistant professor at Northwestern University's Feinberg School of Medicine, and State Senator Robert Martwick, a Democrat who represents parts of Chicago's Northwest Side. Thanks to you both for joining us. State Senator Martwick, let's start with you, please. Why was it important for you to introduce this bill?
Well, it was pretty clear that with the perfect storm that was created by the pandemic, the amount of pressure that was put upon our student population was showing very identifiable results. We saw nationwide suicide rates amongst the children aged 15 to 24 just skyrocket. In fact, becoming the second leading cause of death amongst age population suicide, and it push in the General Assembly to address them, but it does no good to offer the programming, and this was one way of letting students know that by removing that stigma, that it was okay for them to address their mental health and seek the help that they need.
And Senator Martwick, thank you. I think you broke up a little bit, but I think we got the crux of what you were getting at. Dr. Gill, how can 5 mental health days be useful for students over the course of the school year?
Thank you. That's a great question. I believe that if we empower youth, particularly older youth, to identify when they're feeling challenged mentally, just as well as we might allow them to acknowledge when they're feeling challenged physically, they can learn to utilize those days to be more of a benefit. And I think that with proper legislation and changes in policy at the school district level, you'll be able to have youth to have skills developed to learn how to most benefit from those days.
And Dr. Gill, sticking with you for just a second, what impact has COVID had on the mental health of young people?
Yes, COVID is a condition that has definitely been challenging for youth, families, and the mental health and healthcare system. It has definitely caused an increase in youth who are presenting in ERs and in psychology clinics, and caused an increase in waiting lists, as well as less adults in the presence of kids to identify them at a prevention level. And so when they do present, they tend to have increased level of severity of symptoms with much more complexity. You'll see a lot more anxiety and depression.
Okay. Senator Martwick, have you noticed less of a stigma as of late around mental health and among youth and children?
Well, I think that there's been a move through societally, which is a good thing, it is less of a stigma around addressing mental health, and that has been part of the messaging that mental health care is a part of overall health care. We have to attend to all of the parts of our body, not just if we have a cough or a fever, but if we are having mental health issues, we need to attend to that. Again, when we saw the rising suicide rates among students, we said to ourselves, okay, there is a disconnect there where these children are suffering through mental health problems, but they don't have that ability to connect and suffer in silence, and that leads to what we see are really bad outcomes. And so this bill was designed just to do that, to say, hey, if you need to take a day off, just as if you wake up one day and you've got a fever, if you wake up one day and you're really feeling that stress and pressure, you can take a day off and attend to that. If after a number of days, you're still not able to get the help you need, then the school has the permission to refer you then to a counselor, a school psychologist, a social worker, to help connect you to those resources so that you can attend to that, to those issues before they become problematic.
And Senator, how does this bill ensure that young people are actually getting the support they need on those mental health days and they're not just playing hooky?
Well, it doesn't, and that's the short answer. I've been asked that question a lot, and My response is this, and I think there's a fair amount of skepticism. What about those kids who will take advantage of this? To which I say, it doesn't matter if we pass this bill or not. Those kids that would seek to take advantage of skipping school are going to do that regardless of what we put in the law. This is about making sure that the kids that need mental health have that access to it. And that certainly was the motivation there. We would rather offer those that need the help the opportunity to get to it than protect against those that were going to take advantage of it either way.
Dr. Gill, what do you think adults, parents, teachers, other staff, what can they do to help kids and youth feel more comfortable coming forward about their mental health concerns and needs?
So you find that youth are reporting that they have less stigma about accessing mental health services, less stigma about asking for help and support. However, when they do reach out to adults need to have the right amount of education and skills to help them to navigate systems of support, whether that's a school system that is providing mental health access within that building, or whether that's getting a first appointment at a clinic or a hospital or presenting at an ER. So I do think that that is one of the cautions of understanding the implementation of this law. Essentially is what will be the structure and policies put in place by experts and at the school level to ensure that youth are getting the support that they need beyond when they call in, as well as during that time.
And to that end, what more do we need to be doing? Maybe apart from this bill, or maybe, in conjunction with this bill, but what more do we need to be doing to ensure that young people are getting the mental and emotional support they need, especially returning to in-person school this year?
Yes. So what we have found is that some school districts, even here in Chicago, are investing in building out systems and supports to make sure that the people inside of the building are talking to one another, whether that is building out a referral process where students can self-refer. They've indicated in a pilot study that was done by Chicago Public Schools this summer, they've indicated that they are interested in referring themselves if they are in need of supports, and just getting adults together in the building to talk about which students need more support and how they can identify that. Chicago has invested in something called behavioral health systems or behavioral health teams that is allowing adults to come together and help to solve that challenge.
And this goes into effect in January. We'll be keeping an eye on how students are using it. In the meantime, thanks to our guests, Dr. Tara Gill and State Senator Robert Martwick.
Thank you.
Thank you for having us.